This segment is brought to you by Brown Chevrolet Buick in Wamego, just a short drive down the Yellow Brick Road.
Hello and welcome to Horsing Around. I'm Dr. Chris Blevins here at Kansas State University Veterinary Health Center, and today we're going to talk about the Coggins Test. The Coggins Test for your horse and what that includes. Initially, most people get a Coggins Test, especially if they go over state lines, and then question, what is the Coggins Test? Why do we do it? Well, the Coggins Test actually tests for a certain disease, a certain virus called the equine infectious anemia. And that virus is in the same realm of viruses as the HIV in people. So that is something, and AIDS, so that at least helps people understand a little bit about the virus and why we test horses for this disease. It sure would be nice if we had a vaccine for that type of virus, but again, just like in people, we don't really have a good vaccine for it, so we do testing. And with that as the test of the horse, it's called the Coggins Test. We submit and draw one red top tube of serum blood of the horse, and then we submit it to the lab. That lab runs a test as an AGID or an ELISA test, and then those results are then submitted on a documentation that the owner then keeps for either when they go to different shows, may be required, or when they're going across state lines and have to be on a health certificate. Most current Coggins tests need to be at least 6 months, but a lot of states require it to be on the health certificate for being 1 year. So if it's been a year since the Coggins test was taken, it can go on a health certificate. Always remember that whenever you do a Coggins test, that again, it does do just a point in time, and some want to have a test that is fairly recent. So with those things, always keep everything in mind when it comes to testing. Do we have equine infectious anemia in the United States? Do we have it in Kansas? The answer to both those questions is yes. We do have positives for the disease in the United States and even in Kansas. The prevalence is very low, but this is why we do testing. So we can find those that are positive, so we can then talk to, and it's reported to the state veterinarian, and they make recommendations whether to quarantine or sometimes to even euthanize the horse based on where the horse is located and if we could quarantine it far enough away. So why would that be an important aspect of quarantine or euthanizing? Because the disease is spread by biting insects or biting flies or even dirty needles. So again, any of those aspects could play a role in transmitting that virus from one horse to the next. So always use a fresh, clean needle whenever you're vaccinating your horses so you don't transmit a disease called equine infectious anemia. The other thing is, based on the biting flies, that if they just start with biting one, they could go and transfer to another horse. And again, the prevalence is fairly low, but it's always possible to have a positive even here in Kansas. If you have any questions or concerns about the test, please contact your veterinarian or call us here at Kansas State University Veterinary Health Center and we can give you more information about it. I'm Dr. Chris Blevins for Horsing Around, and we'll see you around.
Tallgrass Commodities offers producers bulk commodities at a reasonable price with reliable service throughout the whole Midwest. To find out more about Tallgrass Commodities, visit tallgrass.us or call 785-494-8484.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.